Well, thank you everybody for joining us this evening. We're excited to put this on. This is a new program for be a part of the conversation, navigating insurance for families impacted by addiction. We know this is a challenging topic, and a lot of families are going through different barriers and obstacles when their loved ones are seeking treatment. So we hope this is an insightful and informational program for you all, and you get something out of it. Um, Thank you to our community partner, the Chester County Department of Drug and Alcohol Services, for funding this program. This is another year and another, they're always innovative in their programs that they help support to get out to their community members. So we appreciate their efforts. In addition to our community programs, we have our supports for parents specifically impacted by loved one substance use. So we have our parent partnership meetings. These are support groups that are similar to an Al-Anon or Nar-Anon. They're not 12-step based, but they're another way that families can find ways to navigate their child's substance use. We have some meetings on Zoom, some are in person. If you go to the website, the purple ones are in person for the calendar. We have 21 of these meetings a week. 11 of them are on Zoom and 10 of them are in person across the greater Philadelphia region. So they're color coded. If you open up the in-person one, it'll give you the location. The leaders, parking information, just general information about the meeting. And if you open up the Zoom ones, it'll give you the leaders, but it'll also give you the Zoom link so that you can access that, from the comfort of your own home as well. In addition to that, we have our family recovery course. This is a three-part peer-led educational program to help parents, caregivers, guardians understand what addiction is, how it impacts the family system, and how the family system can start to heal regardless of where their loved one is at with the substance use issue. All of our programs are free. The family recovery course does have a capped participation of 12 people per course. So if you're interested, register ahead. We have another one starting next Monday, I believe, if my um, math is correct. Yeah, I think it's Monday. Um, and then we're going to have another additional series put on the website soon, starting in July, so that these are always available for families to access various nights of the week. It'll be 3 consecutive Mondays, 3 consecutive weeks, but it's another good resource. And Sharon, who's going to be sharing a little bit later, is one of our instructors, so you can always go to her for any information on what it's like. So that brings us to our presentation this evening, navigating insurance for families impacted by addiction. I'm going to get into a little bit more of the just kind of overarching, like what does health insurance look like? How does that cross over with behavioral health or substance use related treatment? So some of this may be a little, elementary for some people, but some, may be really relevant and just, provide a little different insight into what it takes to get a loved one into treatment, the different levels of care that may be appropriate, and what that looks like from a cost perspective, if it is through one of those private or employer-based insurance plans. So realistically, and a lot of this is really going to focus on how services are accessed in Pennsylvania for some of the services. Every state operates differently in how they want to support and fund people who are in or seeking recovery, because we're based in southeastern Pennsylvania. That's kind of the animal that we know. But we can help guide you to finding supports in your state through various ways that are kind of universal. But as a lot of people access their insurance through private or through their employer-based plan. The most common plans that are accessible are the high deductible health plans, the HMOs or health management organizations, or PPOs, and I forget what that one stands for. There's a couple other ones that that may be that may be less frequently used, like EPOs or POSs. But these are kind of the three most common, and we can kind of answer any questions that may be related to that. But I'm going to get to a little bit more in depth into that on the next slide. Into how those are differentiated and what type of costs may be associated with that. Medicaid and Medicare are two government plans that are accessible. So for Medicaid, it's based on your income level, whether you're accessible for that. It is considered an insurance, and we know that, like from Max and I know from working in the space, that it can be a barrier to finding and accessing treatment. But there are ways to get treatment when you are on Medicaid. Um, Medicare, we've been hearing a lot more challenges of people trying to get into treatment with Medicare. So, we know that there needs to be more access there. And, somebody on the call is on the meeting is, that's one of her pet projects. So she may be able to share any insight if some questions come up related to that. But then some people are uninsured or underinsured, where there's a lot of costs associated with it, or they may have no insurance or access to insurance. So there's different challenges that arise there. When we look at the employer-based plans, the three most popular ones are those high deductible health plans, the HMOs, the health maintenance organizations, or the PPOs, the provider organizations. I knew it was preferred provider, I just forgot. There's a lot of different costs associated with that. So everybody, if you have those, your premium comes out of, either your paycheck or something that you pay on a monthly basis. When the out-of-pocket costs look different, and then your access to different providers looks different based off of what type of health plan you're signing up for. The high deductible health plan has a high deductible, as it says in the name. And what that means is you have to pay a higher amount out of pocket before the insurance starts to kick in and start covering services. When you sign up for an HMO or a PPO, your premium may be a little bit higher than that high deductible health plan, but your deductible may be lower. So, it's kind of like there's different offsetting costs that may be there, depending on how much you're utilizing the coverage. Those out-of-pocket costs, are really differentiated based off of the type of plan that you select or you have access to. So those high deductible health plans, have a lot more upfront costs until that deductible's met. Then costs go down, and then costs will be eliminated once you meet your out-of-pocket maximum. When you have an HMO, the costs are generally lower. So it's, could be co-pays for, admission, for outpatient visits, but it's usually a fee associated with each visit. So it could be a long time you're paying comparatively to the HMO or to the high deductible health plan, but the amount you're paying per visit's a lot lower. And then out-of-pocket costs for moderate to high, are moderate to high, just based off of the way that they're structured. So they're a little bit higher than the HMOs, but it's really dependent on how that benefit package is set up. And the one question we hear a lot is that flexibility with providers. So high deductible health plans and PPOs often operate very similarly in the access to the providers you want. The challenge there, the benefits there are that you can, some of the plans may restrict you to see only in-network providers. If you're seeing an out-of-network providers, the costs associated are going to be much higher. with an HMO, a lot of them, you must use in-network providers, and you would need referrals to seek outside help and support. So, that's just like another barrier to, maybe another barrier to accessing a provider in a moment of crisis. And then the one other thing about health high deductible health plans is you have access to a health savings account, so money can be put aside on an ongoing basis. It's not one of those use it or lose it types of plans. Where you can build up savings and revenue, and it can be even invested once you reach a certain threshold. So that's just like another benefit to that health savings account access if you're using a high deductible health plan. So we talk a lot about the various pathways to recovery and like what it looks like in the treatment process and the costs that may be associated with that. What we would love to have is somebody goes to treatment, they go to inpatient treatment, they step down to a PHP, a partial hospitalization, or an intensive outpatient, they step down to an outpatient, they find their continuum of recovery supports, and it's this like nice, perfect straight line. But we recognize that there's a lot of ups and downs in that process. So this is just to highlight that there may be steps backwards and forwards or entry at different points in the recovery continuum for different individuals. So there's a lot of different ways that this next slide can occur for people. So the first step to a lot of people's treatment process and accessing some type of behavioral health care plan is that intervention or some type of behavioral health and substance use assessment. This can be done, if you can get a professional from like an interventionist, an addiction therapist. There are sites in Pennsylvania that are designated as assessment centers that I'm going to touch on a little bit later. And those are accessible, without a fee. Interventions, may be a little bit more expensive, but and it's not like the show Intervention anymore, really. There's a lot of different trained professionals, and there's a lot of different schools of thought. That may help get the loved one into treatment at the appropriate time. Step two is that like hospitalization level of care. So whether that's, they may need a medical detox, or they would need, inpatient residential treatment where it could be, like a 30-day or 28-day inpatient stay. And a lot of those would fall under the benefits related to the plan's general inpatient hospitalization. If you're going through a benefit structure or through your employer benefits. And there's a whole bunch of different ways that people may get this type of treatment. There's wilderness programs, there's extended residential plans, there's aftercare with residential components. So this looks a lot different. So we're trying to keep this as generalizable as possible. Once somebody was to leave that, where they would have that high medical acuity and need to be in a setting for that 28 duration, there's a lot of different ways that people could continue along in that recovery continuum. Really, it's that recovery, we always try to promote that recovery for a lifetime. So finding that community that would ultimately help support that loved one, their family, and help them find that sustained recovery, whatever that means to them. So whether that's 12-step based or smart recovery, Dharma, sober active communities, sober communities in general, there's a lot of different ways that people can find and sustain, probably non-clinical based recovery support services with some clinical work scattered throughout that. When you look at the clinical side of things, there's definitely costs associated with that. So partial hospitalization is PHP, where somebody would go a couple days a week for multiple hours, so they could get some ongoing clinical support. That steps down to intensive outpatient, where they may go 2 or 3 times a week for a shorter duration, like 2, 3 hours, and then general outpatient where they maybe go weekly, or finding that in person, or finding that behavioral health or substance use specific provider who can help support them in the recovery journey. The other piece that goes into this that maybe costs that is not often covered by insurance is that sober living or transitional living. There are programs in Pennsylvania that do have some funding available for family members or for the person in recovery so that they can find that sustained one. But all of those outpatient benefits would fall under the outpatient level of care, is just seeing a specialist. So if your plan has copays, it would fall, if it's a $20 copay for specialists or a $30 copay for specialists, it would be that each time you go along. For the deductible plans, all of your deductible would need to be met before things would start to be covered. So that benefit structure that we discussed earlier kind of touches a little bit into that. But that's kind of how the benefits and the pay would work for that. And I know Max is going to touch a little bit more on like finding in-network versus out-of-network providers, to really figure out what the best course of action is for your loved one. If you're uninsured in Pennsylvania, and it runs similarly in other states, but not every state is the same. You can get access to behavioral health treatment and support at no cost to you. There's a lot of different funding streams that allow for that. So the stipulations are, you must be a resident of Pennsylvania, and there's no other resource available for treatment service. So you don't have insurance, you may not have Medicaid, you may not be eligible for Medicaid. All the counties and the single county authorities who oversee drug and alcohol treatment have designated assessment centers. And I know we have some of these on our website, but we'll make sure to have this included in the follow-up page of like how to find your local county's assessment center. A lot of them may be through the emergency department at a hospital, if they have a behavioral health component associated with it. Some of them are specific drug and alcohol treatment centers that have assessment sites there. And the referral, once you get that assessment, you would get recommended for an appropriate level of care based on that assessment. That referral must match that level of care. So if they think you need, residential level of care and you say, no, I want to go to PHP or IOP instead, or just outpatient, they would not fund that. They want you to meet the level of care that the behavioral health assessor, determines may be the best for you. There's other stipulations that we can kind of get into a little bit later, as some questions may arise, because some of this is stuff that Max is going to cover to talk through that. But this is for the full recovery continuum of care, and there are some sober living centers across Pennsylvania that are accessible to have those be funded. Part of that be funded, while you're maybe seeking, recovery, seeking employment and things like that. So that's pretty high level, like the general way to access care in Pennsylvania. So that's really all I have. I'm going to turn it over to Max. Max has worked in the behavioral health industry since 2014. His experience spans from nonprofit startup organizations to longstanding institutions that are trusted leaders in the workplace behavioral health. As an expert in the field of behavioral health, his experience as a leader, clinician, and administrator allows him to work with people to navigate any behavioral health issues. Together with his clients, he knows the connections that they forge will lead to a lasting positive impact. His work is guided by his undying pursuit to challenge assumptions, analyze current systems, and offer data-driven solutions that work. Leadership can be assured that by working with him, they will achieve the greatest possible outcomes in employee health care and performance. So I'm going to turn it over now to Max.
Good evening, everyone. I'm really excited for this program. I have brought the idea up to Kim a year, maybe a year plus. I feel like this was something that I wanted to talk about a long time ago because I have a guilty pleasure with insurance. I get a little overexcited when it comes to talking about insurance and helping people navigating insurance. One of the reasons is because I worked for probably one of the best insurance companies, even though they're not really an insurance company. It's called Mental Health Consultants. That's where I learned about insurance, learned about the ins and outs of insurance after I had been introduced to it as a case manager at Recovery Centers of America and found it really interesting. So I hope that after this conversation and presentation this evening and answering any of the questions that you all have, we come out of here with a different relationship with insurance instead of such a fearful and pessimistic view of insurance. My goal is to help you realize that insurance can be an ally if you understand it, if you ask questions to the right people who really have studied and know about this insurance landscape. So that starts me by going over the real core mistake that most people make, which is going out of network versus going in network. Um, you have to know the signs to look for staying in network with your insurance company. If you are lucky enough to have private health insurance, then it's often easy to clarify when you have an HMO or an EPO because oftentimes they don't have out of network benefits. But if you do have out of network benefits, I would caution almost all the time, especially in the substance abuse field, of using your out of network benefits and really unless you understand what they are, how much it's going to cost, and that the provider can essentially charge you whatever they want. So your insurance might pay a portion of that, um, but you can really dig yourself into a hole by going out of network in the substance abuse field. You have to understand the different acronyms, different lingos, different abbreviations, all of which can be answered by your health insurance company. I know that no one loves to call Blue Cross Blue Shield, me being included, and be sitting on hold for 15 minutes, but it's 15 minutes that could be well worth your time, especially if you're able to speak with a manager, which you should totally ask for, and understand what your in-network coverage is, who the providers are that are in network, and what your out-of-network benefits look like, what the out-of-pocket max is, what the deductible is. Usually they're going to be very high unless you have an extremely expensive, high premium, low deductible plan. You're really going to want to stay in network. The reason that I am such an advocate of staying in network and using in network benefits instead of out of network benefits is that out of network providers are not regulated or overseen by the insurance company. Insurances traditionally and theoretically are employed by psychiatrists, physicians, social workers, professionals and experts within the field of health care and specifically in this discussion, behavioral health. So there's a lot of times I think people will run into the issue, well, I need an authorization, and no one knows what an authorization means. Okay, an authorization is a good thing. An authorization means that, excuse me, that there needs to be clinical justification for the services being provided. Okay, out of network providers do not have to provide or request authorizations. Okay, so providers can just render services without any clinical documentation. So oftentimes in addiction treatment, there will be a partial hospitalization program billing for 30 days of partial hospitalization when they don't have the clinical rationale to, to justify it. Um, but, one of the great things about working with mental health consultants, in my perspective and their paradigm on treatment, is that prevention is best. So if we can get the best amount of treatment for a client in the episode that they're at in treatment, it's less likely that they're going to come back to treatment. They're going to get the treatment they need, and it's less likely that they're going to relapse and need additional treatment. Some insurance companies, not all, are very stringent and stingy on how they authorize care. This is a problem. This is also something that you can advocate to your treatment team for better documentation, because all insurance companies are held to the standard that if clinical documentation is provided, um, then you're going to be able to get that treatment covered, right? And there is objective criteria that insurance companies are looking for. It's really up to the clinician to be able to um, provide that justification. And this really ensures that providers are working off ethical guidelines. Insurance companies can make sure that the providers aren't over abusing um, the treatment and rendering more treatment than what's necessary, which is often the case. Providers will render 30 days when the client only needs 20 days. The goal of treatment is to get the client to a place where they can live without treatment. And it also holds clinicians accountable. As a clinician myself with a practice, one of the reasons I decided to take insurance was to make sure that I never get sloppy on my documentation and administrative skills. I think it's one of the things that we don't learn in school as to become clinicians. And it's one of the biggest shortcomings of secondary education for healthcare providers is that they're not learning how to document, they're not learning how to justify care in the right language to communicate with the insurance companies. Because it behooves everybody to be able to share the right information with clinically sound documentation. Thank you. I was just about to say we can continue the conversation of in-network and out-of-network on this slide. So one of the biggest problems that clinicians come to me with and say, well, how am I supposed to diagnose somebody after meeting them just one time? And in order to bill insurance, you have to have a diagnosis on the claim. This is an ethical pet peeve where there are so many very general diagnoses that you can put on a claim where you are not labeling or stigmatizing anyone. So anybody who says they don't want to put a diagnosis, they don't want to be held accountable to put a diagnosis on a claim form, they can put generalized, adjustment disorder or adjustment disorder, unspecified, which is essentially meaning you're going through something that requires you to talk with a therapist, which everybody can benefit from. So that's one of the problems where clinicians find the reason not to go and join insurance panels, which is an increasing trend. And it's really problematic because it reduces care for something that is a medical condition. People are paying for their medical insurance a lot of money. The premiums are way higher than they've ever been. Deductibles are higher. One thing I wanted to add on to what Bob was talking about with deductibles and different types of plans is that oftentimes we're really scared of deductibles and kind of we're discouraged by how high they can be. Some good insurance plans have $2,000 to $5,000 deductibles before the insurance starts paying anything. That is not true, because when you have an insurance plan, you benefit from the negotiated rate with the in-network provider. So even if you have a high deductible, you still want to go in-network because you're only paying the negotiated rate, which is a lot lower than the usual and customary rate, which is the UCR rate. Again, importance of staying in-network, even if even if the provider mistakenly tells you, oh, your insurance isn't going to pay anything, use your insurance and stay in network. There's also something that you need to look for within your insurance plan, which is common, not as so as it was 5 years ago, but carve out policies. Carve out policy means that your mental health, dental, vision, pharmacy benefits are managed by someone other than your major medical insurance. So, like, you can have Independence Blue Cross, which is the big local Blue Cross Blue Shield company in southeastern Pennsylvania. And forever they carved their mental health and substance abuse benefits out to Magellan, which is a behavioral health carve-out company that just does behavioral health. So Mental Health Consultants was or is a behavioral health carve-out. All they did is mental health care. They were experts in mental health, same as Magellan, so to say. I think Optum is also a behavioral health carve out for United and some other large insurance companies. But you really want to make sure that you don't use your major medical insurance network, that you use your mental health network. Um, if you have any questions about your network coverage, you need to call the number on the back of the insurance card. You do not want to rely on the providers to confirm this. Unfortunately, providers just do not know how to verify benefits. They go on these little online verification platforms, they check a number, and they look at the benefits, and then they say, you're good to go. But 2 weeks later, they might realize, oh, you have a carve out because they didn't actually call the number on the back of the card that said to call the mental health department. I don't know what they think that number is, but they don't call it. And so, 70% of my calls at mental health consultants were navigating people who went out of network when they were told by the provider that they were in network. And so that happens way too often, and it costs providers and clients a lot of money because clients can say, well, you told me I was in network. I wouldn't have come here if, and some providers, some feel obligated to eat the costs, but not all of them. When it was their, it's technically up to the member to verify benefits. It's not up to the provider. That's something else that you need to know is it's always good to call yourself when you're looking for in-network options. Okay, we can go to the next slide. So, again, I love insurance, and I think it's a resource when you understand it. I think that there are many different ways, and I think that insurance gets a bad rap because of how big of a business it is and how difficult it is to navigate and how it's and how expensive it is. So with the cost, I encourage you to do your due diligence in looking into how can it be a resource. I get emails all the time from my insurance and my carve-outs about services and programs that they are offering to help their members. So insurance companies are working to be resources for you. It's just a matter of trusting and tapping into those resources and not listening necessarily to the providers, as providers don't like insurance either, but listening to your insurance company and sticking with their network. Insurance companies have come to really implement and offer employee assistance programs, which is something that I work with and have been offering different companies is employee assistance and behavioral health consulting in the workplace. And that's where the bio came from. I do a lot of therapy in person in Narberth as well, but um, another thing that I'm really passionate about is EAP and supporting workplace mental health. Another thing that insurance companies do is they can connect you with providers. The message that it's so hard to find a provider these days is because people don't trust their insurance companies and call them. You can get a list of providers from your insurance company, but if you don't find anybody who's available with your insurance company's list, you need to call them and ask for more help, and they will assign you a case management team. Okay. All insurance companies have case managers, and all case managers are providers or are certified and oftentimes licensed clinicians themselves. So you need to tap into that resource as well to find the correct provider. I know that we were talking about Medicare and Medicaid. You can do the same with your Medicare and Medicaid plans as well. Um, they are excellent resources in finding out who is in network. Again, I can't stress this enough, especially in the substance abuse term, and there's going to be a lot of people who are upset by this, but do try to go in network. There are so many amazing providers that are in network with a lot of insurance companies, but there's a whole lot more that are just out of network. And they say they take your insurance, they say they work with your insurance, but you need to make sure that you're not going out of network because they will charge you a lot and they will tell you that and they won't tell you that they're going to. It's really capitalizing on the crisis of the moment and taking advantage of people when they're desperate. But trust your insurance company over the providers, please. Um, I talked a little bit about utilization review and why this was such a beneficial service that insurance companies do. It's holding the providers accountable. It's holding providers accountable to make sure that they're rendering services that are justified and appropriate. If a therapist is billing for 3 individual sessions with the same person every day, that's there needs to be just some justification to that. So they need to have documentation and clinical rationalization as to why they're rendering those services. If you happen to go out of network with an outpatient provider or even an inpatient or higher level of care provider like partial hospitalization or IOP, you need to know and ask them and your insurance company how to submit super bills or itemized receipts for reimbursement or to go to the out of network deductible. That's the only way you can guarantee that you're going to get money back. A lot of providers or a lot of insurance companies accept assignment of benefits, which means that they will pay the provider directly rather than reimburse the member. This is this is becoming somewhat more common, but not always the case. It was the case where provide insurance companies would reimburse the member would pay the cost um, to the provider, and then after the member had gone through treatment, they'd get a $10,000 check from their insurance provider and they'd spend it on whatever, just fresh out of recovery, and they'd find this check, and the provider would never actually see the money. So they'd like write a IOU, wait till the member got paid, and then the providers would never see the money. So that was a big problem as well. So insurance companies have learned from their mistakes, and that's changing. I don't know if I have another slide. I think I have. Okay, ways to use your mental health. I talked a lot about this. Not yet, already. So for outpatient, there is a lot of ways to get and find in-network psychiatrists, therapists, intensive outpatient providers. Uh, One of the best ways to do that right now to find available quick care is to go onto one of these credentialing platforms, which have made it very easy for outpatient providers who want to take insurance to take insurance and have it not be so complicated if they don't know how to do it, if they don't know how to bill insurance, if they don't know how to get credentialed. Programs like Alma, Grow Therapy, some of them you've heard about, Headspace and Headway. I've heard a lot of marketing from them. They really push to be a resource to the providers in collaborating with insurance companies. It's a great movement that's been happening to get people connected with care quickly because they just have so many providers right away available via telehealth, or some of them are actually in person. So that's something that you can also work to utilize. Again, I can't emphasize this enough. If you have questions, if you have concerns, if you have trouble finding providers, then you want to use your insurance, which I encourage you to do. Um, please call them. I encourage you to call them at 8 in the morning if you don't want to wait on hold with Independence Blue Cross Blue Shield. Other ones are not so bad, but Independence is notoriously busy. If you don't trust the person you're talking with on the phone with Independence Blue Cross or another large insurance company, trust your gut and ask for somebody else. Ask for a manager. A lot of them are are not well trained. They're not well versed in certain nuances, specifically with behavioral health. That's why I'd encourage you to call, if you do have a car, if you do have a carve out to, sorry, getting a call here that I gotta turn off. Okay. Um, that you can speak with a manager, advocate for yourself with the insurance company, despite the size, the stigma, and the sometimes seemingly incompetence. They are a resource for you more so than the provider. I can't stress that enough, that the insurance company is a resource for you more so than the provider finding a provider. Providers are good at giving therapy, giving care. They are not good at the administrative stuff. They are not good at navigating insurance. They need a presentation like this. So I hope there's some providers on here right now. But and yeah, you need to make sure that you have clarification on who your network providers are, whether or not you have a carve out, and out-of-pocket costs that can all be clarified with a call to your insurance company. So I am really excited to hear questions that you all have. I do offer consultations on insurance for individuals and companies. I can definitely help with navigating this landscape with more specific situations and cases. Everybody's situation is different. It is unfortunate. I do want to validate the insurance situation in this country is really challenging and confusing. And I want to encourage you to still utilize it despite that. And I think that the more people who find ways to learn about insurance can then trust it and then can find the care that they or their loved ones need faster, and more affordably. Because I don't think that you need to burn through all your pocket finding care these days. Maybe 15 years ago you did, but not anymore. So, looking forward to hearing your questions and feedback, and I'll provide my number. Hopefully, I'm not sure if my contact information is on the presentation, Bob, anywhere, but I can put it in the chat.
Thanks, Max.
I think that's all I
Um,
have. Is there
yeah,
any more slides?
yeah, that was it. That's my
Okay.
contact info in there. I can put that in the chat as well. So I'm going to stop sharing and we can open it up. If anybody, I know Sharon was going to share a little bit about some of her family's experience when they were navigating behavioral health services for their child. So, Sharon, if you want to jump in.
Hi. My experience was a bit different. Max, I could relate to a lot of the comments you made. Um, as Bob introduced me at the very beginning, I'm also a family recovery course instructor, and I am also very active in a parent support group and speak to an awful lot of parents who have sent their loved ones to treatment, specifically their kids, sons, daughters, young ones, old ones. Many have spent significant amounts of money on treatment. It's kind of all over the map. There's people who have had to take a second mortgage. Um, it can be very costly. I think Max provided some great insights in how to leverage health insurance if you have it, especially going in network when possible. In my own personal experience, I had to go out of network. Um, it was costly. I will say that the provider that my son went to worked with us to provide the required paperwork. Max referred to it as a super bill to itemize every line item that could potentially be billed to insurance. And they were willing to work with me to help ensure that we got coverage for anything and everything possible. And, if you're lucky enough to have all of it fall in a calendar year that's a really hefty calendar year, at least you could potentially hit your out-of-pocket maximum, which is a lot of money. But once you hit it, they cover everything. The other thing I will say is that I think a lot of people overlook is that, and I am not a tax accountant, but the IRS allows you to deduct healthcare expenses if they are more than, I believe, 7.5% of your adjusted gross income. So again, if you have a calendar year that's a hefty calendar year, I encourage you to find any and every medical expense that you can possibly group together. Um, so there are ways of making it easier. It can be a very costly endeavor. Um, for me, it was money well spent, and I wouldn't trade it for the world. Um, Bob, if you want to open it up for questions.
Yeah, thanks for sharing that, Sharon. And there's, like after I'm done presenting, there's always a bunch of things that I always like think about that, like, oh, I should have mentioned that. And now I don't
Yeah.
remember all of them, but you touched on a lot of good things there. And people have different experiences in accessing. And somebody just shared another resource. Oh, the one thing I did want to share is if because people recognize the impact of the cost of behavioral health services, there are also like foundations and scholarship agencies that help support some of the services that insurance may not cover. I know there's like a couple programs that help with like recovery housing, and some of the opioid settlement funds are going to like funding those in the Philadelphia region specifically, or will help cover other just like rides to treatment and things like that if people are going from a recovery residency to a treatment. Thing, and somebody just shared this other program in the chat, that's covermymentalhealth.org. It's another nonprofit that does a lot of self-advocacy for insurance coverage. So it kind of like is a step-by-step guide to what we talked about if you're running into barriers to accessing behavioral health care for yourself or for your loved one. So just like another, there's we don't want to reinvent the wheel when we're trying to like do all of this work and like education in the community. So providing other resources for groups that are doing good work, we always appreciate. I did see in the chat somebody asked what the difference between a PPO and an EPO is. So a PPO is, as we said in the earlier slides. Let me pull that up and go back to that because it's going to be a little easier to talk about. Did I close that window already? Hold on, I gotta open the slideshow again. I mistakenly closed it instead of minimizing it. But
While you're doing that, Bob, two quick things that came to my mind. One is that appeals often work with insurance companies. If they say no at first, don't assume that no means no. It is entirely possible that an appeal could work, sometimes even a second appeal, and get something covered. And the second thing is that once you are engaged with a provider, i.e., a treatment facility, my experience has been that they will work with you, especially once you're established. So, for example, say your insurance covered the first 30 days and you want, your loved one needs to stay longer, they recommend they stay longer. Be upfront and honest about your financial capabilities. And I've found oftentimes that not just my own experience, but others as well, that they will work with you. They have
no,
a vested interest in a positive outcome.
Thanks, Sharon. Appreciate that. So I'm just going to share my screen again briefly. And this was the slide kind of breaking down the difference. So PPO allows you to go to any provider you want. It offers in-network and out-of-network benefits. May have that higher premium. And then EPO is basically they have their network of providers that you can use, and they have no coverage for out-of-network benefits. I don't believe they would do like out-of-network exceptions. That may be up to the policy themselves, but that EPO is just kind of an exclusionary provider organization. I think is what that stands for. Max, do you have anything you want to throw in there?
Yeah, no, I absolutely. I can't believe I forgot it because it was one of the busiest things, the things that kept me the busiest at MHC was single case agreements. If you find a provider that feels really like an excellent clinical fit for yourself or your loved one, yeah, and to Sharon made a great point about appeals, right? Advocate for yourself and ask for a single case agreement, which means that they will honor in or they will write up a contract just for your specific case with that provider to get them covered for, as an in-network provider so that you won't have to meet your out-of-network deductible or out-of-pocket max. And I don't think that anyone really said this, out-of-pocket max is the maximum that the insurance will need to pay before you're covered at 100%. Again, out of network, there is no contracted rates. So there is no, the 100% of your out-of-pocket max is based off of rates that are established by your insurance company, but don't have to be honored by the provider. So again, there is the balance billing aspect as well, which we didn't really talk about either, but that's why single case agreements are such a great thing where you can advocate for with out of network providers. And so EPO, Bob, you made me think of that. Even with an EPO, you can advocate for a single case agreement because it's not out of network, it's in network once they have that agreement.
Patient without going to inpatient first. Yeah, I think that's, pretty simple way of saying it is, that assessment, may say that that's the appropriate level of care at the time. And some different challenges or recurrence of use or relapse may occur. And, I know for me, like when I entered my recovery, I went right to outpatient because, that's where I was at. I was also, not the most honest about what my use looked like. So, I was able to sustain recovery through outpatient treatment only. Did not need to do inpatient. Max, any other insight there you would want to throw in?
Yeah, it's up to the clinician's discretion as well, whether or not they want to treat the client because there's a risk of being medically stable with certain substances that the client could be using if they're using alcohol and they go to an outpatient provider, but they're drinking abusively and have the potential for withdrawal, the outpatient provider can refuse to treat them because they need a higher level of care. So that is a situation that could occur, but it does lend the outpatient's discretion, outpatient provider's discretion. And the reason that inpatient is often recommended when there's a medical withdrawal from a substance is because you have four walls. There's no way that someone can go use if they have a craving, which is oftentimes outside of their control. That's what the disease of addiction is that it's a power that is needs to be intervened um, by other factors.
Thanks, Max. Kind of a follow-up question. Can you go to inpatient being sober on that day that the person goes there for like a person who may have had a relapse that are sober so many days and then relapse? I think that would really ultimately be up to I mean, you can enter sober. Um, depends on the authorization and all that stuff when you're talking about like
Insurance might not cover it if they're sober. Like say someone relapses one day, wants to go to inpatient, they might not get approved for a significant amount of days. However, again, advocating with your insurance company to ask for more information from the provider. If you feel like you need inpatient and there's a therapist there that also feels like you need inpatient, they need to be able to justify that to the insurance company. So again, advocating, and you can get some time approved. Even if you get 10 days from a relapse, that's a huge advantage that you have getting away from the substance.
hope that answered your question there.
Are we all excited to call your insurance companies now?
I don't think I would go that far.
Ah,
The hold music alone. Kind of like, if he's in treatment, like kind of go with the guidance of the discharge plan. Like what does that look like if he's in treatment? That's like usually the recommendation I would go to, and they would probably be able to, like, if it is go back to California, they would probably have like a network of resources that they've vetted and trust. When costs come into play, you can always look for like foundations that support that type of care if costs become a barrier. Or look into like what is the county, how do they fund that type of service in the state? Is there insurance reimbursement for any of the services, that type of stuff? But like really like, so going with the guidance of like the discharge planners, they've been doing it a lot longer and know the systems that they would be referring out to. Would probably be my recommendation based on the question. Did that answer what you were asking? As long as they were a resident of the state, like that's really the big determining factor for Pennsylvania. And like knowing, and I believe California has some pretty robust addiction and recovery support services, that they may be able to have, those things. And Max, do you have any insight into that?
no, not a whole lot. Sober living is not an insurance thing, and it's not covered by insurance. It's not something that insurance companies look into or consider in their approval or network status. So it's not something I know. I used to work as a case manager, so I know that in finding sober living for discharge planning, it was often attached to a treatment center in some way, shape, or form, or working as its own company. But I would be surprised if California would pay a sober living in Pennsylvania. I would be surprised. I would think that, he could probably, it would have an easier time accessing funds through Pennsylvania's resources for a Pennsylvania house over accessing California resources for a Pennsylvania house. Yeah. Yeah, it's a great question and something that I would get a lot. What you need to do is get her an evaluation from either the provider, the treatment center that she wants to go to, and they can call me or someone else that knows about what the insurance company is looking for in terms of documentation and clinical presentation. You're not going to get detox covered, but you might be able to get a few days of rehab covered. And depending on your insurance company, it's going to be how stringent they are. But has there it would also depend on like whether there's been an attempt to get authorization or if the insurance companies just say, no, it's not covered, right? Which is what they can do. They'll just say, oh, it's not going to be covered. That's not necessarily true. If she's running out of jail to get high or get drunk, they might cover, you know, and they have to have the clinical documentation to support that. So if she goes into an evaluation and says, I'm having cravings, I'm having psychological withdrawal, I can't do this, this, and this, I have these types of mental health symptoms, I'm not eating, I'm not sleeping, blah, blah, blah. I'm at a substantial risk of relapse if I don't go into treatment. There's a good chance that insurance could cover it. But she needs to really present that honestly to a clinician, and the clinician needs to present that to the insurance company. It could be both. You know, she could go to a psych hospital and then to a rehab, or like a psych hospital, get some stability after jail, and then go to an intensive outpatient program for substance use. That could be really beneficial too. You know, there is the piece that like she might not need rehab even if she wants it. She might not need it even if she wants it, if she feels comfortable in it. She could still be successful in an intensive outpatient program or a partial hospitalization program, which is much easier for insurance to cover because it's a lot cheaper, half the price for insurance per day.
This is what the Department of Drug and Alcohol Programs in Pennsylvania has listed as their way to find substance use providers in the state. So it's vetted by the state representatives, the state drug and alcohol programs. It's a good, reputable source, and the filters are like very impressive by substance of primary use, any mental health conditions, your geography. Like it's pretty, they've made a lot of improvements to it since it first came out, because I remember looking at like the beta testing of it and it was pretty bare bones, but it's really, the filters are very impressive. But yeah, it's a good resource for if you're looking for a certain type of treatment for yourself or your loved one.
Not with substance use. You just have to have high risk of relapse at a lower level of care is what insurance companies are looking for. If you're at risk of a relapse, if you're having cravings, eh, better luck going to like an emergency room if she's having like suicidal ideation or anything
Okay.
like.
Yeah, if there's no insurance involved, then Pennsylvania to get it funded, you would have to go through an assessment center. Whichever one's closest geographically to yourself, be able to go to there, is kind of what they recommend. Yeah, you'd have to accept their level of care that they recommend.
Oh, okay. All
Mm.
right. Thank you.
Yeah, no problem.
Absolutely. If it's a low enough paying job, you have to be lower. Like they have different income expectations that they'll look for. They'll request tax statements and W-2s and stuff like that to verify that you're under the maximum amount. But if if he's making like $12 an hour or $15 an hour, you can probably qualify for Medicaid.
If he goes and gets an assessment when he's released, or case management support set up, they would probably be able to work if there's case management while he's incarcerated. They may be able to connect him to resources for upon his release. But if he does get that assessment and they determine an outpatient level of care, there is outpatient funding in most of the counties in Pennsylvania, that could be, followed along. It's not just for that inpatient level of care. So there may be ongoing supports available. It would just be, that assessment's the big piece, getting that completed is my understanding of the way the system works. That's one of the things with that treatment atlas is like it gives, some of the outcomes associated with the facilities as well that, we had shared briefly. If you are uninsured in Pennsylvania, regardless of, you can qualify for county funding, regardless of where you live, your income. You can go get an assessment, if you don't have any access to insurance. And I know, like on the continuum of care and like the the multiple ways of the treatment path options, that slide that I shared, just a reminder that like a lot of the community-based recovery supports are free to access. So whether that's AA, NA, Dharma, Smart, there's a lot of sober communities that are really popping up, that those are always a low barrier resource, that can be a very good support for the person that needs the recovery supports. But then there's also a lot of support for the families out there. So if you are all struggling trying to navigate this, we have our parent partnership meetings, but there's also Al-Anon, Nar-Anon. There's Smart for Families. That's mostly online. But there's a lot of resources for the family members who are trying to navigate their, loved one's substance use as well. So just to put that there are free community-based peer supports available. One thing I did forget to mention that is there's a big push for certified recovery specialists, certified peer specialists, that can also be a good resource. A lot of times accessing them through, there's different agencies that accredit them across Pennsylvania and across the country, to utilize them as a resource, as they may have some, they have good knowledge of the system, and they're just kind of, a lot of those services are free to access, because of the way that Pennsylvania funds that. So talking your loved ones who are struggling, there's people that they can talk to that are professionals that really understand that, how they navigated it, and how to navigate the system in the area that they're living as well. Well, if there's no more questions, we can end it for tonight. I really appreciate all the engagement, all the questions. Um, there was a lot of good things asked, and we'll be sure to email everybody with the follow-up page once the recording's posted, so that everybody has the links, and can get the information provided, including the slideshow and all of that stuff. But feel free to reach out with any questions to myself. I know Max put his contact info in the chat as well. I'm sure he doesn't mind taking people's calls either. But we appreciate your time this evening. And yeah, have a good evening, everyone.